Hello and welcome to the Diabetes Army Rebuild podcast. My name is Dan, type 2 diabetic in remission. And this is a podcast that I put together to bring to you some of the sciences that are happening in the type 2 diabetes community and to talk about things, create awareness, create some positivity, but also help people in their struggle or their fight against type 2 diabetes. And so my story is I'm a former pro athlete, was on a pro wrestling tour for 12 years, and when I left, I went in the business world, and what happened? Type 2 diabetes happened. So I've been working towards spreading awareness and trying to get mine in remission. I was on over 7,000 units of insulin a month, and I gained about 180 pounds. I was just thinking about this the other day, how much weight I actually gained on this. So I gained about 180 pounds. I'm down about 145 right now, and I plan on hopefully driving towards getting down another 25 before the end of the year. So that's my overall goal. Of course, I'm focused on the process, and we could talk about that on another podcast. But I've created this podcast, and it's evolved over time. And now what we do is we look at peer-reviewed studies. We don't do the bro science. We take a look at peer-reviewed studies and find out what's really going on in the type 2 diabetes community, or things along the lines of pre-diabetes or insulin resistance. What affects us as type 2 diabetics? And I want to be clear this about type 2 diabetics. I also want to be clear, I am not a medical doctor. I do not give medical advice. I present facts to you, and hopefully you take these to your doctor, or you take them and see how you can use them for yourself. But I don't give medical advice. And always, I say this constantly, have a great doctor as your partner. In wrestling, I had a lot of tag team partners, and my doctor now is a tag team partner of mine in this fight. So I was listening to a podcast a while back, and it was actually Huberman Lab, and Andrew's a friend of mine, and it was all on mouth care, and I learned so much from that, and I started thinking, what would the effects be of, say, mouth care and dental care with type 2 diabetes or pre-diabetes? So I dug up some interesting facts on some studies that were done. So let's dig into this and see if you can learn anything from this. So according to this study, I'm going to just name some of the names that were involved with this. This is all peer-reviewed. Robert J. Genko, Paul Eke, George W. Taylor, Catherine Cowie. There's a number of them, but I wanted to touch base on some of the folks that were involved in this. So this study, it's a vast majority of U.S. adult population suffers from periodontal diseases, as about 90% suffer from reversible gingivitis. Hopefully I'm pronouncing this stuff right. Forgive me if I'm not, but you're going to get the understanding of what's going on here. With almost 50% of adults greater than age 30 were affected by periodontitis, which is a chronic periodontal breakdown of both the soft and hard tissues that support the teeth. Very, very important, this stuff. Diabetes prevalence is assuming epidemic proportions, with 30.2 million, or 12% of the U.S. population greater than the age of 18 having diabetes. This was in 2015. Just so you know, and this is how much this has grown, because right now I think there's about 22 or 23 million type 2 diabetics in the US and about 92, 93 million pre-diabetics. So this is from 2015, and look how much this has grown. Of whom about 1/4 are unaware of their diabetes. That has grown immensely, by the way. So many people don't even know they are pre-diabetic or type 2 diabetic because they're afraid to get work done. More eye doctors tell anyone about their situations than actual regular doctors do. So, which is stunning. So an additional 1/3, 84.1 million have pre-diabetes, of whom 90%, and I would say that number is probably still sitting about the same area there. Actually, I thought it was 80. It could be 90. Don't even know pre-diabetic. So as I say, any room you're sitting in today, 50% of that room is either type 2 diabetic or pre-diabetic. And sadly, if that includes family members, it does. And it might be up to you to have that hard conversation, or at least get a conversation happening with them so they can take a look at this stuff. So let's talk about your dental health and type 2 diabetes or pre-diabetes. Gingivitis is a reversible inflammation of the soft tissue surrounding the teeth in response to dental plaque, whereas periodontitis is a chronic inflammatory disease in response to dental plaque that causes breakdown of the soft and hard tissue surrounding the teeth in people. The destruction occurs without any pain or symptoms. Nonetheless, if left untreated, it can lead to loosening of the tooth and eventually total loss, with adverse effects on nutrition, self-esteem, and function. Never mind the self-esteem, but just walking around with no teeth and trying to function, trying to eat. There's so many things. And often, people say, well, my teeth are a little loose. Well, this is probably what it was from ignoring them for quite a while. And it goes on to say that, moreover, the number of teeth lost is strongly associated with atherosclerotic cardiovascular disease. So the advance of tooth loss, especially endodontulosum, loss of all teeth, is associated with premature all-cause mortality. So how important is this? I would say it's very, very important. It's the inflammatory responses that lead to development of worsening of hyperglycemia, hence contribute to the increased blood glucose levels in healthy individuals. So your blood sugar, right? This is it could affect your blood sugar because of the inflammation, right? And we know with type 2 diabetes comes inflammation, which is what we're trying to combat, right? Which leads to the development of pre-diabetes, type 2 diabetes, and just overall glycemic control, worsening diabetic complications. So this really does play an effect on your type 2 diabetes, your pre-diabetes, whatever the case may be, when you're sitting there and trying to put this stuff in remission, which is hopefully what your goal is, right? Diabetes is also a chronic inflammation-related metabolic disease. Well, this we know is type 2 diabetics, right? So you've got one feeding into the other one. So blood glucose negatively impacts the inflammatory response to dental plaque. So it makes it harder to fix this stuff with your type 2 diabetes or pre-diabetes, because you've got all this inflammation happening in your body, right? So such improvements could consist of quitting smoking. If you want to turn this stuff around, these are things that can help. Decreasing intake of added sugar, reducing any inflammation, and getting sufficient sleep at healthy times per the circadian rhythm, right? I say this time and time again. I've got 4 pillars in life. Number 1 is mindset. Number 2, nutrition. Number 3 is exercise. And number 4, and not the least of which, is sleep and rest. We need to get sleep and rest to rebuild our bodies, especially with the type 2 diabetes. All right? So what can help? Non-surgical deep cleaning by the dentist. It could come together to be a big help to you, right? You want to keep your teeth on point. Other things. Brushing your teeth in the morning, and what I learned on the Huberman podcast was, as important as the morning one is, the nighttime brushing and flossing of your teeth is huge too. So you got to do this twice a day, and for some folks it's even 3 times a day. Often people will brush their teeth after they eat. So minimum of twice a day, and you have to floss as well as brush your teeth. All right. So together with proper oral home hygiene, so just what we just talked about, this can lead to improved glycemic control in type 2 diabetes, all right? Both diseases negatively affect each other. This we know. Therefore, it may take both medical and financial sense to include the attainment of a healthy mouth in diabetes management. So, in other words, work on your teeth, work on your oral care. This is something that you've really got to get some sort of control on, because you think about the financial costs and the benefit to the individuals, their caregivers, and everybody else. So it costs a lot of money to run with type 2 diabetes. We know this. Meds aren't cheap, and you end up going down that insulin path. This is something you want to really turn around. So you want to be fixing and doing as much as you can in many different ways, right? This study talked about sleep. We often talk about sugar intake and carbohydrates, and we've got some great podcasts coming up about that. There's so many things you can be doing, but just oral hygiene is a big one. And now there's a lot of talk about oral hygiene and the effects it has on our body and longevity as well. So can't stress enough. Let's get the teeth brushed in the morning, right? Let's get flossed in the morning. And as important, let's get the teeth brushed at night before we go to bed and floss before we go to bed. All of this can help with your glycemic control and can really help you in your battle against your type 2 diabetes. Listen, my name is Dan. I'm putting this together to create some awareness and positivity in the community, so you can share this with whoever you think might need some help. Please follow me, Instagram, Diabetes Army, TikTok, Diabetes Army, my YouTube channel where this will be posted as well, and of course Spotify. You'll follow along, share it. Really appreciate you following me. If you have any questions, Instagram's probably the best place to message me on. And as always, let's make reversing type 2 diabetes cool.